is a great mnemonic for the nursing process, ADPI. So the nursing process is a systematic patient-centered approach used by nurses to provide safe and effective care. So the assessment part is where we collect our data. So we want to know vital signs, symptoms, history, what we hear, feel, or see. So both subjective and objective information. Diagnosis is where we're going to formulate our nursing diagnosis. So what will the focus of our care plan be? Planning is going to be where we create our plan, our care plan. So what will we do to help improve our patient outcomes? Implementation, so what actions will we perform? Evaluation is going to be how did the patient respond to our actions? Were there any improvements, and do we need to reevaluate and formulate a new plan? So let's look at a case study where we can use the nursing process. We have a 72-year-old patient admitted with pneumonia, experiencing shortness of breath, fatigue, and a productive cough. So our assessment, which is A, is our subjective data. So subjective would be him complaining about shortness of breath, him saying, when I lay down in bed, it feels hard to breathe. Our objective data, thick yellow sputum that we see. Patient is leaning forward to take deep breaths. We have a blood pressure that's high, a heart rate that's 100, and a temperature that's 103 orally. We also have a pulse oximeter reading of 93% on room air. Our diagnosis is D, and we're going to use our nursing diagnosis of ineffective airway clearance. Planning is going to be our goal that's going to try to improve oxygen levels and mucus clearance. Our implementation is I, which is where we're going to decide what are we going to do for this patient. We're going to provide oxygen, maybe some fluids, possibly some medications, and we're going to continuously pulse ox monitor that patient as well as reposition them. Evaluation is where we look to see did any of these things actually help the patient. We're going to monitor their response, adjust the plan if we need to. Are they feeling better? Are they breathing better? Has their pulse ox improved?